Hello everyone, in this video we're going to be looking at the Organization and Triangles of the Neck section of the course pack. This resource is brought to you by the Scrubs team, which is the Student Collaborative Resources for Understanding and Brody Success. My name is Bryce Pugh, I'm in the class of 2027. Let's begin with the Scrubs mission statement. Scrubs is a student-driven initiative that aims to develop supplemental resources for current and future cohorts that will pass through Brody. Members of Scrubs participate in a variety of subcommittees working to create resources for students by students. These resources aim to offer unique perspective from students that have walked in the same shoes, developing resources that we wish we had been exposed to during our time in the course. The hope is this organization will become a staple of the Brody student body, exemplifying the unique collaborative community that Brody offers. If this is a mission that aligns with your goals and you have the desire to help those that will come behind you, as well as a goal to leave your mark on Brody as a whole, we invite you to join the team. And a quick disclaimer as always, the resources that are included in this document are made by students and not faculty. As such, there's a possibility for errors in our development, although this is mitigated via team approach to development with multiple stages of vetting. If there's a contradiction within the coursework presented within your course, or if there's a contradiction to the coursework presented within your course, please go by the course documents. Additionally, Scrubs aims to supply supplemental resources. However, these are in no way a replacement to the instruction of the Brody faculty. Use these resources as a supplement, but not as your primary source for course material. And so let's start this video off with a couple important osteology landmarks. Most of these should be familiar already to you, but we'll first point out the styloid process. And so that's going to be right here, styloid process being styloid coming from the pillar or column word that means something like that. And that's going to be this pillar-like bone that projects down from there. And that's going to be really important in the coming chapters too, because a lot of muscles and ligaments are going to be coming off of that. I also want to point out your mastoid process, which is going to be this hard part right here. If you put your hand behind your ear, kind of behind your earlobe, lower down, you can feel that right there. That's also going to be important attachment point for muscle. And then we have our hyoid bone, which is going to be super important, especially in this section, which is this U-shaped bone you can see right here, and that's going to be wrapping around your neck right there. And so we're going to have a lot of muscles that come off of this below it and above it. So this is a super important bone. You want to see that it's got its greater horn that projects anterior posteriorly, and its lesser horn that projects superior inferiorly. And then we also have this body at the anterior section. So let's begin with the organization of the neck. The neck is a super important structure of our body. It has all sorts of important and complex structures, and so we want to have an important way of keeping that organized so it's not just sloshing around in our neck. And the way that we're going to do that is with fascia. So fascia we see all over the body as ways of compartmentalizing important structures. And so in the neck we're going to divide that into a superficial fascia and deep fascia. So our superficial fascia is going to be superficial to here, whereas what this diagram is showing is the deep cervical fascia, which is all of these. So superficial is going to be where the platysma muscle is. So you can see here, this really thin muscle is the platysma muscle. If you frown really hard, you can kind of feel that protrude in your neck. And so that's a first superficial barrier. Once we get a little deeper, we'll hit our deep cervical fascia. And this is a lot more complex. So we're going to group that into 4 with some subdivision, but 4 main sections. And so this is a cross section of your neck, and so from out to in we'll start with our investing fascia. That's going to be this green one, and it wraps around your trapezius muscle at the back and your sternocleidoid muscle at the front. So that's the green. We then have let's go apart from this, let's go prevertebral fascia. So starting from the back, just past that we have this blue. The prevertebral fascia, as you can see, is going to wrap around your vertebrae, as well as all of the associated vertebral muscles and a bunch of other smaller components, but that's this blue one here. Moving more anteriorly, we're going to have, let's do the visceral fascia next. So our visceral fascia is this purple one. It's labeled pretracheal here because, yeah, you can see the buccopharyngeal fascia is a component. So we're going to refer to this as our visceral fascia, which is the combination of both of them. So our visceral fascia is pretracheal anteriorly. So you can imagine anterior, it's pretracheal, before the trachea, because the trachea is here. Posteriorly, so on this side, is our buccopharyngeal fascia. Between our buccopharyngeal fascia and this section right here that connects the carotid sheaths, which is called the alar fascia, this section here, this space is the retropharyngeal space, and this will be really important clinically, as we'll see at the end. So our retropharyngeal space is between our buccopharyngeal fascia, which is part of the visceral fascia, and our alar fascia. This alar fascia is a part of our last section, which is the carotid sheath, and so that's the red. So you have a carotid sheath on each side connected via this alar fascia. The carotid sheath is super important because it's this fascia that wraps around three very important structures, and that's going to be from medial to lateral. Medially, we have our common carotid, more inferior, and as you move up, it'll bifurcate into your internal carotid, which stays in the fascia, and your external carotid, which exits the fascia. Laterally, so you can see here, that's medially. We have laterally, our internal jugular vein is going to travel down within the carotid sheath. And then we also have our vagus nerve, cranial nerve 10, that sits kind of between, but a little more posteriorly, right here. So that's posterior between right there. So this will be a really important structure that we'll get to. And so now let's look at the triangles of the neck. So like I said, we have all sorts of super complex, tiny structures in the neck. And so what we're going to do is compartmentalize. And we're going to use superficial structures to compartmentalize deep structures of the neck. So we're going to have certain muscles and stuff that compartmentalize it. So we have our posterior triangle back here. So we'll have first section, posterior versus anterior. Posterior you could subdivide a little bit, but we're mostly just going to say posterior. Anterior, we have a lot of stuff. So we're going to further break that down into four more triangles. So we have posterior is one, anterior, and a bunch. And we'll look at these divisions in a second. But so let's start with our anterior muscles of the neck. Before we get to the triangles, let's look at some of the muscles that'll become important. And so like we pointed out, the hyoid bone is going to be super important for our suprahyoid muscles, which are superior to the hyoid, and our infrahyoid muscles, which are inferior to the hyoid. And so as you can see, a lot of these are named very similar stuff. Omohyoid, sternohyoid, sternothyroid, thyrohyoid, stylohyoid, blah, blah, blah. And so it's going to be really hard to just rote memorize all of this. And so what I want you to get used to doing is looking at the name and seeing what you can get from the name. And with these muscles, more than a lot of things, you're going to get a lot. So they're going to have the stylo, the first half, as its origin. Hyoid, the second half, is insertion. And you'll see that common with all of these. Same thing with these, omohyoid. It's the omo to the hyoid. It's the sterno to the hyoid. And I'll point out what all this means. But starting with the suprahyoid muscles, like I said, pay attention to the names. Suprahyoid muscles, we have our, let's look at it this way. So looking at this picture, we have our digastric muscle, which is the weird one that you'll just have to remember the name, but it's digastric. So di meaning two, has two bellies. So we have one muscle belly right here, which is right here under our chin, and then it loops around with this common tendon to our posterior belly. And you can see that right here. It loops around to the posterior belly. And that's why you can see the digastric, the insertion is the mastoid process, the origin is the mandible. And what's interesting about this one is it's going to have dual innervation different for each belly. And so this is going to be really important to know. We've actually looked at these in different videos. So if you look at cranial nerve 7, the first one of this section, there was a cranial nerve 7 branch that goes to the posterior belly of the digastric. We have our cranial nerve 5, branch 3, goes to the anterior belly. And all of these, the function for all of these are not going to be super important. It's kind of swallowing speaking, but mostly you want to be able to identify them and recognize by the name what they're attaching to. So that's our digastric. That's the hard one. Okay, so now let's move on. So we have, looking at this, we'll go from superficial to deep. So you have your digastric. So what's going to be important with this is paying attention to how deep you are and what direction the muscle fibers are traveling. So most superficial, we had our digastric that we talked about. And this is right in here. We have our digastric. And then we have our mylohyoid. And we'll look at all these a lot more when we get to the triangles. But Mylohyoid, mylo coming from mandible, hyoid. So mylo to the hyoid. And that's innervated by cranial nerve V3 as well. Because remember we saw the branch that goes to the the anterior belly of the digastric and the mylohyoid. So those two right next to each other, you can see. It makes sense that they're going to be dual innervated. And we'll see later the posterior belly with the digastric and the stylohyoid share innervation because they run together too. And you can see that right here. These two are going to share innervation. These two are going to share innervation. And this will make sense when you see it in lab too. And then deep to the mylohyoid is our geniohyoid. And again, we'll look at that later, but genio, another part of your mandible to the hyoid. Our infrahyoid muscles are going to be the ones inferior to our hyoid bone. So again, we want to pay attention to the names. Our omohyoid is going to originate at the scapula. So omo comes from the word meaning shoulder or something like that. So we come from our shoulder to our hyoid, and that's this long one that runs all the way out wide. And this is also can be split into a superior belly and inferior belly. So that's a really important muscle for distinguishing different regions. So keep that in mind, omohyoid. And all of these infrahyoid muscles are going to be innervated by the ansa cervicalis that we'll get to. Except there has to be an exception for everything. That's our thyrohyoid. And so, again, I wouldn't get too bogged down in all of these. Just be sure to pay attention to the name, and you can figure out what these muscles are doing. Omo to the hyoid. Sternohyoid, or sternum to the hyoid. So that's going to be this green one that goes all the way up. We have our sternothyroid, not hyoid, sternothyroid. That goes from our sternum to our thyroid cartilage, right here. And then our thyrohyoid. So thyro, going to originate at the thyroid cartilage, hyoid, and come down. And that's the exception, thyrohyoid. That's our, that's innervated by cranial nerve 12. And so we'll revisit these a little bit in a second, but before we really dive into the triangles, let's look at the cervical plexus, which I briefly mentioned with the ansa cervicalis. And so this is a plexus of nerves coming off of the anterior roots of C1 through 4 and kind of a little bit of 5 that is coming out at your neck. And so we're going to have cutaneous branches, which you can tell are going to go to the skin, and we're going to have the ansa cervicalis, which will go to muscles. And so I split it down going left to right, but these are all from the same root. So our cutaneous branches, all over here, we're going to have these 4 endpoints as well as some of these. But first, from top to bottom, there's going to be a lot of names, but I want you to, again, pay attention to the names, and that'll help you realize what you're going to. So we have a lesser occipital, occipital meaning your occipital bone at the back of your head. So you can imagine that's going to run to the back of your head. And I'll show you a picture of these in a second. We have our great auricular ear, that's going to run up behind your ear. We have our transverse cervical, that's more at your cervical region, so that's starting to go a little more down the neck. And then we have supraclavicular, so just above your clavicle or your collarbone. And then you want to memorize what roots they're coming from too. So it's 2, 2, 3, 2, 3, 3, 4. So make sure you know that. And then moving down, a couple branches of these are going to go off and join cranial nerve 11, the accessory nerve. And so cranial nerve 11, as we know, innervates 2 muscles, our trapezius and our sternocleidomastoid. So that's going to come down. Each section is going to get joined by the anterior rami of our cervical cutaneous branches here. So our accessory to the trapezius is going to be joined by 3 and 4. Our accessory to the sternocleidomastoid is going to be 2 and 3. And so you can think from sternocleidomastoid is anterior, your traps are at the back. So you can start at the front and go 2 at the front of your neck, 3 at the side of your neck, and 4 at the back of your neck. And so the sternocleidomastoid is going to be 2 and 3. Accessory to the trapezius will be 3 and 4. So they both have 3, just 2 is at the front, 3 is at the back. And so you'll need to study this a little bit, but this will be really important to know. We also have our ansa cervicalis, which comes from the word meaning the loop of the neck. And as you can see, it forms this loop. And so our ansa cervicalis is comprised of C1 through C3, the anterior rami. And so C1, we can see it just comes straight across here. This is just for the drawing, but it's going to come straight across, get joined by cranial nerve 12, and they're going to ride together. They're going to ride together to the thyrohyoid muscle. C1 will also go to the geniohyoid muscle. And so then, and I'll summarize this in a second, but we're going to have an inferior root of our ansa and a superior root of our ansa. So our inferior root is more directly coming off C2 and C3, and it's going to loop up around here, where the superior root will then connect it to C1. And so what you can see, we're going to have a bunch of branches that give off muscles. And what these are, is these are all of our inferior hyoid or infrahyoid muscles, or most of them at least. And so we have our inferior omohyoid, and again, you want to memorize all these. So C2 is innervating inferior omohyoid and superior omohyoid, sternothyroid and sternohyoid. C1 is going to do thyrohyoid and geniohyoid. So memorize all those are C2, and then the exceptions of these two are C1. And if you can get this drawing down, you'll know that that's from up here. We also have, which is really important to know, is anterior roots of 3, 4, 5 come down to form our phrenic nerve. Our phrenic nerve is going to be really important in the next section once you get to the thorax, because it innervates the diaphragm. It innervates a lot of the diaphragm. And what the diaphragm is really important for is breathing. So the phrenic nerve does a lot of innervation that's important for breathing. And so there's a mnemonic people say, roots 3, 4, 5 keep you alive because they help you breathe. So the phrenic nerve is 3, 4, 5 to keep you alive. And so let's look at what this actually looks like on the neck. And so this is super complicated. That's why you want to simplify it with a drawing. But we can see our motor branches coming off in purple, just like how I drew back versus front. So our motor branches are going to come down here and form this ansa cervicalis here. And we have all of our branches coming to our infrahyoid muscles. And that's why it makes sense now that it's going to be at this region with all of these. Our sensory branches are all going to come off towards the back. So we have our lesser occipital coming here, our great auricular going up to the ear, and you can follow them, our supraclavicular coming down here. And so you can see the region, the transverse cervical is going to come around here. Transverse meaning it's crossing the cervical region. And so again, I want you to think about the names when you think about it. You'll have to memorize or come up with a mnemonic for the exact roots or get the drawing down, but think about the muscles, what it's telling you. And you can know, well, there's one that I know that goes to the back of the head. I know it goes to the occipital region. Oh, it must be the lesser occipital. And so another thing I want to point out is that this is super dissected, but once you start dissecting, your posterior border of the sternocleidomastoid mastoid is drawn right here. And so these cutaneous branches are going to come and wrap around the posterior border of the sternocleidomastoid. And so now let's get to the triangles of the neck, which are going to be most of the meat of this section and a lot of the contents you need to know. So let's start with the posterior triangle of the neck. Our posterior triangle is going to be back here. And what separates it anteriorly, the anterior border, sorry, this is flipped from the pictures, but the anterior border is our sternocleidomastoid muscle right here, right here. And so if you turn your head to the side, you'll feel your sternocleidomastoid protrude, and you can grab it. It's connecting from your clavicle or your sternum all the way up to your mastoid process. And so you can, or your manubrium, you can feel it right here going up. So that's our anterior border. Posteriorly, we have our trapezius, and inferiorly, we have our clavicle, which is cut right here. And so as you can see, there's a lot of contents, and it's going to be like that with most of these triangles. And so it's going to be really hard to just rote memorize everything. So what I would recommend is get the triangles drawings down, make sure you know the drawings well, and really study it on the cadavers, because that's really going to lock it into your mind, and that's going to help you memorize and know what you're looking at, because this is only going to get you so far. But it's still really helpful to know. So let's start with this posterior triangle. So we have trapezius, SCM, clavicle. The important contents that we want to point out here is we have a couple nerves. We have our accessory nerve, cranial nerve 11, kind of swinging down from the top. We have our phrenic nerve that's going to come down and run down through it. And the phrenic nerve is actually being pinned down by two arteries that are going to run across here. These are super, super important to know. Make sure you can identify these in lab. I can almost guarantee that they're going to be tagged, at least one of them. And so you have your suprascapular and your transverse cervical artery. So they're going to run across here and they're going to pin down the phrenic nerve. We also are going to have our anterior scalene muscle, which we pointed out previously with the vasculature video of the head and neck, but that's going to come down here. It's going to cover up some of the brachial plexus, and we'll see the roots and some of the brachial plexus starting to come off into here before it goes off into the arm. So make sure you identify that in lab. And then we're going to have some important vessels, which are your subclavian vessels, artery and vein. And the artery will probably be deep to the anterior scalene, whereas the vein will be more superficial. I also want to point out, you should be able to see the inferior belly of the omohyoid. You can see that crossing through here. Some people will use that to distinguish a superior versus inferior version, but I like to just keep it as one. So we'll see our inferior hyoid. That should be this muscle right here, omohyoid, coming across right there. And so that's our posterior triangle. Now let's move on to our anterior triangle, which is pretty big, lots of stuff. So let's further break it down into 4 more triangles. Great, lots of triangles. So our anterior triangle, we have our mental region right here. We have a mental foramen and stuff that we saw part of the facial nerve comes out on. So submental is going to be right below our chin. Over kind of to the side, below our mandible, will be our submandibular, below the mandible. And then we're going to have our carotid triangle, where we have some of our carotid vessels running through. And then we have our muscular triangle, where all of our hyoid muscles are. So let's look at those. Let's start with the submental triangle. And this one's pretty easy, thankfully. I didn't put my drawing here, but the submental triangle is just going to be right here between the curve of your mandible. And so we have our anterior belly of our digastric coming here. And this is where I was saying it's important to pay attention to the fibers and the depth. So most superficial, we have our anterior belly of the digastric. And the fibers are traveling up and down like this, if you're looking in this way. Traveling sideways, transverse, just deep to that, is going to be our mylohyoid muscle. And so we have our mylohyoid traveling this way. If you then further peel that back, we have another muscle that is, again, traveling up and down in this direction. And that's going to be our geniohyoid. So make sure you know those 3 muscles, how deep they are, what directions the fibers are, because that's going to be very, very important for identifying in lab, which you will have to do. And then we can see the other muscles. That's all that makes up the triangle, but you can follow the other muscles that we've looked at on these. This is a really good picture. Let's now move on to our muscular triangle, which is going to be just inferior to that. So we have our submental here. We have our hyoid bone. Below that is going to be our muscular triangle. So we have our hyoid bone. The borders of this are going to be our midline of our neck. So it's symmetrical on either side, midline of our neck. The sternocleidomastoid muscle running up here. And then the superior omohyoid, which is super greatly pictured here. Maybe that. But we have our sternocleidomastoid, superior omohyoid, which will continue down. But within the triangle, we're going to have all of our infrahyoid muscles. So they'll just be all in here within our triangle. We're also going to have a couple important things that we want to know. Here, I'm depicting our thyroid cartilage, which you can see here. You'll learn that more in the pharynx and larynx section. But you can feel that's where the Adam's apple is. That's made up of the thyroid cartilage right there. Below that, you'll have your thyroid gland, which is also within the muscular triangle. And as you can see here, I've kind of depicted your vagus nerve is running down. The recurrent laryngeal is going to come up through here. You can kind of see it peeking through right there. But the recurrent laryngeal, the important one that wraps around the vessels, make sure you know everything you can about that. That's going to run up through the muscular triangle. Next, we'll look at our submandibular triangle. And so that's going to be our mandible runs along here. It's going to be inferior to that. And so we're going to start to see common borders within the triangle. So our superior border is going to be the mandible here, our bone. The posterior digastric is going to be, I guess this is flipped again, but the posterior digastric, which is going to run back here. Remember, anterior belly of the digastric comes up here as a common tendon. Posterior runs up there. And then we have our anterior belly of the digastric right here. So we see boom, boom, boom. So this is the triangle. It's a lot small, and almost all of it is occupied by our submandibular gland, which is a salivary gland. So submandibular triangle, submandibular gland. So know that one. And running through and around that is going to be our facial vein and artery. These are going to be important to dissect well. You can see the facial vein kind of just travels superficial to it, whereas the facial artery is a lot more entangled in it. So those are going to run through this region. We also are going to have our stylohyoid muscle. So we know that our posterior belly is running back here. Our stylohyoid muscle is also going to run back here, and I'll revisit that a little in the pharynx larynx video, but those are going to run together. We're also going to see cranial nerve 12 running through this just briefly. I'm not sure that it's depicted in this diagram, but cranial nerve 12 could be seen in this triangle here. And finally, let's look at the carotid triangle. So this is going to be a really important one, not too complex. This is going to be moving a little posterior. So we have our sternocleidomastoid as our border. So that would be, it's torn away here, but that would be here. We have our posterior belly of our digastric running through here. You can see that. And our superior omohyoid running right here. So that's right here. And so you can see our submandibular would be right here. Our submental would be right here. Our muscular here, and our carotid right here. So you can see how they all tie together. And again, this will be super, super important to look at in lab. I can't stress enough how helpful that's going to be. And so looking at what the contents of this is going to be, we're going to have our carotid sheath as the main component. I'll quickly also point out that we have cranial nerve 12 running through here briefly, as well as cranial nerve 11, which you can kind of just see running through here. But the main thing we want to see here is our carotid sheath. And so our carotid sheath, we pointed out, is this fascia that's wrapping around our internal carotid artery, which is a branch of our common carotid artery, which is also in the sheath. So our common carotid comes up, splits to internal carotid that stays in the sheath, heads up to the brain, and our external carotid, which exits and starts to supply vasculature. Here you can see to all of our neck and regions like that. So this common splits, boom, boom. We're also going to have our internal jugular vein, which you can see this big blue vessel here. And then posterior, kind of in between, is going to be our vagus nerve. So that's the main things you want to know here. And so make sure you know the borders of these really well. Dr. Askew, more than anything, loves to ask about borders of sections she provides. So know the borders of your triangles very, 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 very well. And finally, to end this video, let's look at some clinical anatomy. So I picked the most important ones that I think you need to know. First, let's say, talking about the retropharyngeal space. So we talked about that, looking at how the buccopharyngeal fascia and the alar fascia have a small space between them. This retropharyngeal space is an important place for infection and inflammation to spread from the prevertebral fascia. So retropharyngeal space, infection, inflammation stuff can spread up through there. Another important thing to know is that anesthesia of the skin, neck, and chest, kind of this region right here, well, that's going to be more with this picture here, but that's kind of picturing the same thing, but kind of that region of the neck, that can be blocked by blocking the cutaneous nerves at the posterior border of the sternocleidomastoid. So we pointed out, this doesn't really show up, but the sternocleidomastoid comes here, all the cutaneous branches of the cervical plexus wrap around there. So they're right in the same spot. You can just block that right there and get local anesthesia. Another thing that's important to know is if you get a superficial wound in the posterior triangle, then you can sever your accessory nerve. So remember, our accessory nerve does the SCM in our traps. So if you damage cranial nerve 11 in the posterior triangle, then you'll get this shoulder droop. So if you see a drooped shoulder in a patient, and maybe they got in a fight and got stabbed in the posterior triangle of their neck or something, then that's what you're thinking is cranial nerve 11. And so the last one that we want to look at here is thoracic outlet syndrome. And this is going to be super, super important clinically and exam-wise. Thoracic outlet syndrome is where you get, it's at the thoracic outlet or inlet, which is kind of at these circled regions. It can happen at a few of these, but this is going to be the main region that we're talking about in this exam is at this scalene triangle, which we didn't talk about. You don't need to know that. But what can happen is the anterior scalene muscle can kind of tense up and compress the parts of the brachial plexus as well as the subclavian artery. You can see that right here. They're both in this region. And so what that leads to is pain and numbness in this upper extremity region, as well as you might start to see like color loss in the distal extremity, indicative of this lack of blood flow. And the veins typically okay, but the artery and the nerves are typically what gets compressed. So this is a super important one. Of all these, I would say definitely know thoracic outlet syndrome well.